Okay, thank you so much for joining us today, Sharray. Thank you for taking the time. I'd like to introduce the audience to Sharray Reed. She is an innovator in the patient experience space. Sharray, can you give the audience kind of an overview of what that actually means?
Yes. My name is Sharray Reed. I am the patient care strategist. I help healthcare organizations teach quality patient care that results in unmatched results from patient care survey scores, and those are kind of across the board. Every healthcare organization uses those, whether it be HCAPS or in-house. So that's what I do.
Okay, great. And are there consistent issues that you find across the various organizations you work with?
Yes, there seems to be an underlying issue with interpersonal skills.
Mm.
It seems like, especially with the new age, it seems like our graduates are younger and younger. And if you add in the distraction of social media,
Hmm.
it just takes your time, it takes your attention away from our patients. We need to make sure that we're paying close attention all the time and giving our patients 100% of our attention, time, and effort. So if we can kind of go back to the basics of having these human skills. I love the term human skills. I got that from Simon Sinek. Um,
Hmm.
those skills are very important in what we do on a daily basis because, within moments, we're asking the patient to trust us with their most vulnerable information. And we have to make
Hmm.
sure that we have those skills available, and are strong so that we can connect and interact with our patients.
Yes, and so I think I hear a lot from of what you're saying. It's the kind of soft skills, those personal touches that the staff can add to make patients feel that they can trust and share their stories. Um, are there things that you would advise patients to do to make sure that their needs are getting met? I think if I put myself in the space of a patient and I notice um, rude or not listening, or maybe they're distracted, or those kinds of things, then I may not even want to fight that battle. So, are
Mhm.
there things that you can do as a patient that help empower you?
Yes. So from the patient's perspective, I myself have been in those shoes. And it was one of those I had to realize that these people are professionals. And this is before I even got in healthcare. I need to make sure that I'm being open and honest about what's going on with me so they can help me in the manner that I need to be helped. A lot of patients aren't trusting the healthcare providers or staff. And, as healthcare workers, we need to make sure that we're exuding that energy of trust and understanding, being empathetic. That way, it makes it a little easier for the patient to go ahead and open up and expose themselves, if you will, and let us in on the information needed so we can help them to the best of our abilities.
Yeah, it's such a complicated issue, isn't it? Because the doctors, they don't have a lot of time
Mhm.
sometimes to spend with the patient, and the patient most likely has the majority of the interaction being with the nursing staff or
Yes.
the administrative staff, right?
Mhm.
um, do you offer trainings, or how do you tackle such an issue? And what if it is, across the board in this organization, you're noticing that there are no human skills? What approach would you take to help guide them?
Great question. So there's a couple of approaches. My company, Impeccable Patient Care, offers uh, training that has a system that has a testimonial base to it. So it's PTS, it's a patient testimonial system, and we use that as incentives for the staff to interact and connect with our patients on a needed level. Those testimonials are used in-house, and they are shared between departments to gain information on what works with the patient. I would suggest having cultural or sensitivity training throughout the year, quarterly, annually as well. It's very important because we actually help a diverse population. So if we get that sensitivity training and take it seriously, because
Mhm.
like I said, I've worked for a lot of organizations in the DFW area, and there are trainings, but I can tell you there's still this disconnect between the healthcare workers and different cultural backgrounds. So that to me is probably one of the most important things that we can do as healthcare providers, is to make sure that we're able to connect or interact with that particular background or demographic. That way we can reach that patient in on their level and what they need to be, um, or what they need to talk about to be able to share what's going on with them personally. So the PTS system, having sensitivity training, and then there's the trust in our leadership, right?
Mhm.
So if they can get us the resources that the staff needs in order to reach our patients, whether it be you know talking through them with different um, language lines. A lot of our patients does not speak the English language, and a lot of deaths has been the reason because we have not been able to reach that patient or understand that patient and them to understand us. So having those resources available for the staff to use when they need, if the patient is deaf or unable to speak English properly. Um, those really help out a lot throughout healthcare organizations everywhere. And they have been a tremendous help in my training.
I love what you're doing. I think it's really wonderful to reach out to patients in that way and sharing this cultural kind of divide, I guess, that we're seeing between
Mhm.
healthcare workers and the patient side. And do you see that growing with COVID pandemic? Has there been more need for this kind of support for patient strategy care?
Um, I, to be honest, I actually think it's the opposite. I've experienced patients that have had more, what do I want to say here? They're understanding that
Mm.
we are in healthcare, we're understaffed, and the numbers in hospitals have shot up, and most of the hospitals are full to capacity. So I've experienced patients being understanding of that aspect, and I believe it's just because from a patient's perspective, I need the help. I want the help, and I want this as easy as possible. I want to make your job as easy as possible. So patients have been mostly understanding that I've come across, um, and it's not a lot of it's not a lot of uh, issues with our patients per se. I think it's issues within how we work together as teams, being shorthanded, being overworked, have experiencing that burnout, the compassion fatigue. If once we kind of get a hold of that, and that's where leadership plays a big role in, being able to
Mhm.
trust and lean on your leadership to pitch in when needed. I think it goes a lot further with the patients and staff alike.
I agree. I think that there are so many ways we can support the healthcare team. You mentioned compassion fatigue, and I hear that term quite a bit, and also, burnout, compassion fatigue. Can you give us kind of some uh, definition of that and what the healthcare provider can look for? I think sometimes maybe it hits suddenly, right? They're not
Mhm.
sure. They're not seeing the patterns of burnout. So,
Right.
what are things they can look for so that they can prevent getting to that point?
A lot of things kind of stem from being short-tempered. When you notice a staff member that's usually on top of it, usually jovial, happy, smiling, and they answer their phone and they're just short-tempered.
Mm,
That's a telltale sign. If your staff are experiencing burnout, it's you just need to look into the departments as a whole and seeing what can we do to help this department with the patient load. And
mhm,
a lot of the healthcare workers are saying, I've been on my feet for 4 hours nonstop, and if I could just use a break, that would be helpful. And we experience that a lot with healthcare. And we're all wanting to get the job done and help the patients out, but sometimes that means just turning to your neighbor and saying, do you need anything, are you okay? And a lot of them will kind of take a deep breath and say, if I could just get 10-minute break, if I can just get a 15-minute break. So I think a lot of the compassion fatigue, a lot of the burnout will kind of unveil itself with the short tempers. We have
mhm.
quality healthcare workers, and they are working diligently to provide the care necessary for our patients. So if we pay attention to the change in attitude, the change in their stance while they're at work, I think we can get a lot further with meeting the needs of our staff as well.
I think that's wonderful. I think that's really
Mhm.
wonderful. And um, I don't think you shared this at the beginning, but what is your passion for this? What pulls you to help provide this patient care to healthcare workers? What is your what did they say that your why? What is your
Yes,
why,
your
Sharray?
ultimate why. I've been in healthcare for over 17 years, and I have been, and this is not to sound braggadocious or anything. I have been exceptional at the patient care side of it. I've received many awards just on my ability to interact and connect with patients on an intimate level. And I found joy in it. And it's so funny that you never really think about your why until you're making a profession out of it. um, and so this just happened to me recently, in the last couple of years of realizing my why and knowing how involved with patient care that I am, and how much I love it. I adore it. I enjoy. It brings joy to my heart when I'm providing a care, and my patients trust that I will provide the best care. And, I say all the time, a lot of our patients, we are the last faces a lot of our patients see, unfortunately.
Mm,
So if you think about that, you know, the connection that has to be had for you to be able to bring out joy in your patient in the midst of going through what could be possibly the hardest part of their lives. That is a
mhm,
connection that I feel like we all, as healthcare workers, we all should strive to provide that type of connection. If I can make you smile, if I can make you joyous, in the midst of going through something very, very hard and difficult. Um, that to me, I have, that to me brings ultimate joy to me, because you just never know when it's going to be your turn to be in the patient's shoes. when you're going
Mhm.
to have to be that vulnerable, when you're going to have to, trust your healthcare workers and providers with the most intimate information um, that has brought you to this place. So for me, it's just providing that joy and happiness and comfortability with patients that are going through it, and they know that this is a hard time, but these healthcare workers, the time spent, the ability to make me first, that is something that I feel like all healthcare workers should adapt. When you are with your patient, be patient focused. Put your phone down, um, and make sure that you're able to connect with this patient, and they know that you're there for them, and that they matter. Okay, it's a lot of times that we are not able to reach the patient, and it's just simply because they don't know that they can trust us. So being
Mhm.
able to, stop what you're doing, make continuous eye contact, repeat the patient's concerns, and I have found the power of touch to be the closest thing to happiness for a lot of patients. So don't be afraid to touch your patient if it's just on the shoulder or grabbing their hand. That has for our processes, that has been helpful in letting them know that we're there for them, and we're going to continue to do what we need to do to provide the best quality care that we can.
I love that. I love that you're putting kind of that responsibility on the healthcare worker of being possibly the last contact that that patient has. That's pretty powerful.
Hmm.
It's really powerful.
Hmm. Yes,
Um, well, thank you so much for your time today, Sharray, and for sharing a little bit about your patient care strategy.
of
Uh,
course.
Before we leave, do you have a book recommendation for our audience?
A book recommendation, I would say, has to be on a self care tip, and I would say, what to say to your, or what I believe it's called, "What to Say When You Talk to Yourself."
Okay.
Um, by Helmstetler is his last name. I can't recall the first name, but look up "What to Say When You Talk to Yourself." For a lot of healthcare workers, they're suffering with lack of self care and things like that. Mental health is at it is mental health disorders and diseases and issues are at an all-time high right now, and that spills over into us providing the best care possible. If we're not taking care of ourselves, we cannot properly take care of our patients. So look into that book, "What to Say When You Talk to Yourself." Last name is Helmstetler. Can't remember his first name, but that's a great, great read.
Great. I will find it and link it in the comments section.
Yes.
And how can our audience find you, Sheree, in the socials or your company? What would they look for?
So I am on LinkedIn, Sharray Reed, the patient care strategist. Our business is Impeccable Patient Care, which is also on LinkedIn. You can email the organization Impeccable Patient Care at info at impeccableptcare.health. And I'll be glad to answer any questions for you, or book a time for us to come out and talk to your staff and do a presentation. We'd be glad to do that for you. Thank you so very much, Taya, for having me.
Thank you. Thank you, Sheree. And I will link all of those in the comments as well so they can find impeccable patient care online. So
Awesome.
thank you for
Thank
your time.
you. You're so welcome.
Yeah.
Anytime.